Thanks for joining us this morning on Your Carolina. This is going to be a fun, very informative segment. Now, if you've been through Spartanburg lately, you may have noticed the big old upward sports complex. I mean, it is huge and it is so cool. And these two guests kind of have a little something to do with that, and some sports medicine and sports therapy. Very timely. We were just talking about Marcus Lattimore, and obviously I bet y'all see that all too much in your line of work, ACLs, MCLs. Dr. John Lucas, sports medicine family physician with Medical Group of the Carolinas, and then Matt Leiden, a sports medicine manager for Spartanburg Regional. Good to have you guys.
Thanks for having us.
Thank you. It's great to be here.
And you're right on 29, the complex, and that's where you are in that complex, right?
It is. So
just opened.
Brand new complex, just opened up a few months ago, and Spartanburg Regional has a medical facility there, so that's where we're kind of operating our Sports Medicine Institute. And it's comprised of 4 things. So we have orthopedic services, sports medicine, you can come in and see the doctor. We've got physical therapy on site. We have a sports performance arm and a research arm as well, and so that's kind of all encompassed into the Sports Medicine Institute, and it really is meant to be kind of a one-stop shop for athletes where you can come in, see the doctor, get x-rays, get a diagnosis, and get better.
Are there other doctors there?
So our group is Pelham Orthopedic Surgery.
Okay.
There will be some other physicians rotating out there, but I'm the only one out there full-time right now.
Now, would we just see you if we had an injury?
Yeah, absolutely. So, you know, I will see anybody that's had an injury, so like a runner that has, you know, chronic pain. Overuse injuries are really common in athletes. I probably see just as much overuse stuff as I do acute injuries. And the important thing is to identify it. Maybe we need to modify or tweak what you're doing, and maybe it's some physical therapy. We have a lot of physical therapy offerings. We have sports therapists that engage just, and they have a specialty just to work with athletes and getting them back to their routine. So that's the important thing to us.
Well, Matt, who have you worked with, your past experiences? Mainly children, or?
So we really, you know, we talk about our program really serving 8 to 80 and all that's active. And we really, you know, we like the athletic population, and we like our student athletes in Spartanburg a lot. So we cater to those guys quite a bit, but everybody that's active is good. And as Dr. Lucas had mentioned, it's really a full-stop shop. So, you know, from injury back to return to activity is really what our specialty is.
So many people, I mean, you think, I mean, obviously with Marcus Lattimore, you know, I'm just using him because we just talked about him because of the, you know, the second you saw that knee, you were just like, he's done. There's no way you're going to be able to recover from something like this.
Well, but he hadn't seen these folks.
Exactly.
Hey, Marcus.
Exactly. But I mean, do people, when they, you know, tear an ACL or MCL, I mean, are they, y'all get them back to playing again?
Yeah, so I mean, there's kind of always options no matter what the injury is, and you know, that injury was pretty devastating, and that's always a tough one to come back from, just because the injury was so extensive. Most injuries, though, you're right, ACL, meniscus, whatever it may be, fracture, injury to the muscle, you know, a strain, sprained ligaments. All that stuff, what you really need to do is you need to have it identified. You need to figure it out early. A lot of people are out there and they're just kind of continuing to go on these injured limbs, and sometimes if you'll just, you know, identify it and
because you're
shut
scared,
them down.
I don't want to have to sit out for 6 weeks, and I can get through it. You know, pop some Aleve, and I'll be okay.
And we deal with that all the time, and you know, and that's why I love athletes. I love that they're willing to grit it out, but sometimes it's better just to come in and get it checked, because we might be able to get you better faster.
Well, after you check someone, I guess many times you refer them to Matt or write a prescription for his expertise.
So what we do is, so you come in, it depends on what you have going on. Acute injuries, we're typically just going to try to protect it, make sure there's nothing bad going on, rest it, and then just kind of walk you through the process of healing. The overuse stuff is really where we are engaging our physical therapists, and that's trying to identify, you know, if someone comes in with a knee problem and they're a runner, let's say they have some tendonitis in their patellar tendon. Well, that's easy to diagnose, but the question is, why are they getting that? And so that's what I'm more interested in, is why are you prone to this injury? And that's where our physical therapists and and sports therapists can really help us with that.
Sure, and we catch those guys too, and like I said, kind of John catches them on the front end for us, and then we'll catch them on the back end to make sure that they don't get back to Dr. Lucas's office. So as much preventative stuff as we can offer as well to our patients.
Do you do like the mental stuff too? Because I've had friends that have, like, you know, torn, and they're so scared. You know, sometimes they're so timid to get back on it. When you hear that, sometimes that's like stronger than your other. You know what I mean? Do you work with like the psyche too, to be like, okay, you're gonna, you know?
Yeah, I mean,
sure, you can run again. You can make a cut.
Absolutely. A lot of times it's, you know, you're in the room with a patient and you're just trying to figure out, well, what, you know, your leg is stable, your knee is stable, you know, what's kind of holding you back right now. And a lot of times they're just
they don't want to get back. They're scared to get back.
A little bit worried about it. Again, that's where physical therapy can help, because then you have this kind of supervised progression, and people feel a lot more comfortable when they have that kind of one-on-one time with our sports therapist.
Well, I'm guessing as we boomers get older, I certainly haven't, but you're seeing more and more folks, you know, that are recreationally athletic. Are you seeing as many now of those as you are like kids in high school playing football?
Yeah, absolutely.
You really are?
Absolutely. So at the Sports Medicine Institute, we have a quote when you walk in that says, "Every patient is an athlete, just at different stages of training."
I like that.
So, you know, we'll see anybody, and I'm just as, you know, focus on getting, you know, a 60-year-old back that's interested in running races as I am a, you know, a 15-year-old back, you know, to get back to high school football or baseball or whatever sport.
And our performance program is jammed up with everybody, like I said, from 8 to 80. So we have kind of a youth and fundamental, a competitive, elite, as well as an adult fit program. So you know, we have 65 and 70-year-olds in our adult fit performance program as well. That we
and Spartanburg Regional Healthcare obviously is part of it, so let's give them a plug.
Yes, you see the information on the screen right there. Go by and check them out, especially if you have, you know, a kid that's doing sports, or if it's just something that's been, you know, plaguing you and you're scared to get out there and hit the streets again running. So thank you guys so much.
Absolutely, thanks for having us.
Thank you, great to be here.